from the book Treat Your Own Chronic Pain, the Chronic Pain Bible for doctors, psychologists and clients. This is my debunk of acupuncture. We spend some $24.9 million per annum on acupuncture specifically for chronic pain in this country. While there is no doubt that acupuncture enjoys widespread support amongst professionals and the general public alike, and even appears as an appropriate treatment on government health sites and can be eligible for Medicare funding, there is no robust evidence for any health benefit whatsoever for anything. And keep in mind that when Medicare or any health fund gives out rebates on junk treatment, it's coming out of the pockets of the people who pay the premiums, basically subsidising health fraud. No robust studies suggest that acupuncture provides relief or a cure for chronic pain. On the contrary, quality studies clearly show that acupuncture is no better than placebo, and fake acupuncture, where there is not even a needle, gets the same results. An idiot with a toothpick lightly applied to any patch of skin would get the same results, possibly as long as they were dressed in a white coat and appeared trustworthy and professional. At this moment, there have been over 3,000 published trials of acupuncture, and not one validated trial demonstrates efficacy. Many are regarded as suspect as they have come out of China, where academics are known to commit fraud in order to get published in a Western journal. According to Retraction Watch, China has a greater number of retractions of paper on acupuncture than the rest of the world combined. One such study by Li et al. On the surface appears to be a randomized controlled trial demonstrating remarkable results for acupuncture. However, it had no experimental blinding, was confounded by other simultaneous treatments, confounded by subjective assessments of outcomes, made no attempt to measure whether or to what degree participants complied with their medication programs over the duration of the trial and follow-up, failed to propose any biological mechanism, and had a deep conflict of interest in relation to the experimenter's need to validate acupuncture. It is massively troubling that this paper succeeded in being published in the prestigious journal JAMA. Sadly, it is far from alone in being a piece of abject junk that managed to get published in a reputable journal. A recent article in Lancet, in a continuing series of exposés on Chinese research, revealed that there has never been a negative paper regarding acupuncture come out of China, and outlined the steps the Chinese government is taking to try to eliminate rampant fraud that is still currently being committed in papers across many fields, including acupuncture. But I don't want to seem like I'm just picking on poor old China. Some Australian studies are no better, with Cohen et al. Reporting the unlikely outcome of acupuncture in the emergency department providing equivalent pain relief to strong analgesics. But even the authors admit there is no mechanism of action. Close examination of this trial reveals lack of sham control, complete lack of blinding, acupuncture compared to treatment with an inappropriate comparator, which was also known to be ineffective, treatment group consisting of back or ankle pain, both of which are known to be hugely variable in pain presentation, and other serious flaws. Regardless, acupuncture-only patients required higher levels of opioids as rescue treatment, and there was not a clinical or statistical difference between the groups. All groups had very poor pain control, which is a known issue with these particular patient groups. Despite the claims of the authors, their own data showed that acupuncture did not provide a benefit and led to higher opioid use. I know it's crazy, but even despite their own complete failure, these researchers claim that they've been successful, and a journal actually published the junk. Unfortunately, not only are we wasting many millions of dollars every year on acupuncture, but we are also wasting time, energy, money and resources on researching an intervention which has been time and again clearly demonstrated to have no valid mechanism and no beneficial effect for anything. Imagine if all that research money and all that time and effort was directed toward finding real treatments for chronic pain or plowed into cancer research. We'd surely be way ahead of where we are now.